Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Ballins.
Hi there, Dr. Darrow. Hello, Dr. Darrow. Are you with us?
Hello.
Hey there. How are you today? I thought I heard you. Are you there?
I am here, Nita. Are you there?
I am here.
Ah, they finally got us hooked together. Thank
Yay.
goodness.
So, are you living it up today?
Of course I'm living it up. What other way is there to be?
I don't know. That's the only way I want to be. And that's how we want our listeners to be, too. So how about let's talk about them for a minute. If you're listening and you have chronic orthopedic pain, which is muscle pain, joint pain, tendon pain, ligament pain, perhaps you have back pain, neck pain, maybe you have hip pain, knee pain, arthritis pain, anything that's musculoskeletal in nature is what Dr. Darrow helps with. And you can call us all hour long at 866-870-5752 right here in the studio. That's 866-870-5752. And when you phone today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It has over 250 scientific studies. The foreword is written by the lovely Suzanne Summers. And there's also some news about hair growth in that book as well. And you might want to also check out Dr. Darrow's website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site and see him performing the treatments on video. And remember, we're here Saturdays at 10 a.m. and again at 1 p.m. And that's all I got.
I got plenty more, Nita, so let me get going
Okay,
here.
great.
This is a very complex question that came in, and I think people will like it because it's a good lead into what regenerative medicine is all about.
Okay, because we also have a
medicine-
couple calls, just so you know.
Oh, okay, yeah. I'm taking a look here. You're right. Let's go right. Let's do that. Let's go right to Terry in Castaic.
Okay.
So, Terry, I assume you've got some knee pain. That's what the call screener says. And how long has that been going on?
It's been going on for several years now. I did all the treatment with various therapies off and on over the years. Tried the cortisone shots. And was having a conversation with my doctor, and my main question his issue was he did not think that the PRP treatment was something that could be done on an ongoing basis as needed. In other words, if it was effective but at some point reoccurred, that it would be something that you can continue to do for years to come. And that was the conversation we were having.
Okay. So
Go ahead.
you know, if you go to someone who doesn't know what they're talking about, you're going to hear a lot of negativity. And we've heard that. I've been doing this over 20 years, and basically all I hear from doctors that don't do it is, it doesn't work, or this is a new one. It'll work maybe for a while, but then later it's not going to work. And I don't know where that guy gets his information from. God bless him. It's not a statement against him. It's just that it's not something he does. So when a doctor doesn't do something, it's bad. Do you understand what I mean? Everything else is bad except what he does. And that's more of a traditional-minded doctor, whereas there are many of us who have moved ahead of that and become more advanced and become more open-minded. So I'm one of the open-minded guys. I've used myself as a guinea pig my entire medical career. I started injecting myself with regenerative medicine while I was in medical school, believe it or not. And everyone was telling me that's impossible, that can't work, you can't grow collagen, you can't grow cartilage. My professors didn't like me back then because I was going against the grain. And even though it's more than 20 years later, 25 years later or so, we still are bucking the old style. And that's the way it is with everything in life, and especially in science. No one wants to move ahead. I don't know what they're afraid of, but they are. With medical doctors, they're afraid if they try something new, they're not going to get any referrals and the hospital will kick them out. So they stick pretty close to the party line. I don't do that. I'm always checking new things out. I'm going to give you an example of something I did 2 years ago, which is going to sound weird to everybody. It's called low-dose antigen, LDA. And I had a chronic sore throat since I was a little boy, long time ago. And I had constant flus. I always had flus. I was taking antibiotics all the time. I didn't know any better. And then a friend of mine named Dr. Alan Green in West L.A., who's an alternative doctor, gave me a couple little shots just under the skin, subdermal shots of LDA, low-dose antigen. That's 2 years ago. I have not had one sore throat or one flu ever since. It was a great miracle. I didn't even know what it was, but I was willing to try it because I trusted him, and he said he was healing a lot of his patients with it. Since then, I've sent other people to get it done. And do I need to know the mechanism? It's like if you say, I want to turn the light on, and I say, well, there's the light switch, push it up. And you say, but I want to understand how it works. And I go, healing doesn't come with understanding or science. It just is. And a lot of my patients don't like me, and the doctors I know don't like me, because I want things that work. I don't need to know how they work. I mean, I can tell you all day long the science of regenerative medicine using your platelets or stem cells, but telling you the science isn't what makes it work. What makes it work is what makes it work. So thank God the doctor that told you this is wrong, and it can work completely by doing a session of it or several sessions of it. Now, can it come back? Is that the question? Yes, it can come back.
The question was much more about the long-term maintenance aspect, assuming it does come back. That was really the question, not that it may not work.
Okay. Well, to me, that's the same question, but I'll direct myself more to the words you're using. Yes, you can injure yourself again after you're healed, and this will work again.
Okay.
Am I promising you it's going to work? No way. I can't promise anybody anything in medicine.
Okay.
But there's a good shot at the fact that it will work. I'll give you an example of my shoulder. I had my shoulder operated on in medical school. I don't know if you've heard the story, but my listeners know about it because I talk about it a lot. It's a great example. I was in fourth year medical school, and I had a weightlifting injury where I stretched out my shoulders doing bench presses, and I had surgery on my right shoulder, which made it terrible. It was a totally failed surgery. My arm blew up like a balloon. I had a high fever, and I thought I was infected. I wasn't. It just was a screwed up surgery, which is what happens quite a bit of the time. I'm not against surgeons when I say this. I love surgeons. They do the hardest job in medicine. Surgery is dangerous. Let's just say it the way it is. There's a lot of sequelae or side effects that can happen. But nevertheless, my shoulder got a lot worse, and I couldn't use it. And it was a couple of years before I discovered regenerative medicine, and I injected my own shoulder, and the very next morning it was 100% completely pain-free with full range of motion. It was like a miracle. I'm not going to say it was a miracle, but it was like a miracle. And at that point, I was experimenting on all my patients. I was trying it on them. I said, this worked on me. It actually worked on my wrist first. 50% better the next day, and then it took a few more sessions to get it healed. Now, I have re-injured my wrist and my shoulder since then, since they were completely healed. The shoulder lasted about 12 years, pain-free, and then I re-injured it again. And at this time it took me 2 sessions to get it better. And then I re-injured it another time years later. And my shoulder's pretty darn good. I'm going to go play golf today. All right? I can weightlift. I can throw a ball. I can do whatever I need to in sports. So yes, the answer to your question, Terry, is you can use regenerative medicine, platelets, and stem cells and get all better or get a little better. And then years later, if you re-injure yourself, you can do it again. Is that the answer to your question?
I guess it would be more in the sense of if you did not injure yourself, in the sense of the knees in itself, where you may get relief for a period of time, and it kind of reoccurs without any real injury, because there was no real injury from the beginning. It's more arthritic in nature, I guess, or with age.
Sure.
So there was no real injury. The question is, if it's effective for a period of time, is it something that can be used in a maintenance sense?
It could be. It could be anything.
Well, no,
I've seen thousands. I know, but I've seen thousands and thousands of patients. I get about 60 to 80 new patients a month. So over those 20-plus years, I've seen everything you can imagine. So it's not cookbook. Everybody is treated differently.
I think the concern may have been whether or not, if using it on an ongoing basis, a potential negative side effect or consequence was more the concern.
Not that I know of, because all you're doing is stimulating more tissue to grow. You know, the old name of regenerative medicine was prolotherapy.
Correct.
Prolo is from the Greek term proliferate, to stimulate new tissue in this case. So as we get older, it's wear and tear. It's like a tire on a car.
Correct.
You can always retread the tire or change the tire, and that's basically what we're doing.
Right. Okay. I think you've.
So you can't really do too much of this.
Okay, that was a concern.
No, you can't do too much of it. I've never had anybody that had a problem because, I do more of this on myself probably than anyone's ever done on the planet.
And then that's why I heard you mention that, and that's what was going through my mind, whether or not when you redid, I know you mentioned your knees, whether or not there was another injury or if the pain just started to reoccur at some point and you retreat yourself. That was what was going through my mind.
Yeah, I just retreat myself if I re-injure myself. And you mentioned something. You said yours is not injury; it's just arthritis. Arthritis is an injury.
Okay, and when I mentioned injury, I meant that I didn't get hurt knowingly, if you will.
Yeah, I got it. You didn't have a direct trauma you were aware of, but
Correct.
Most osteoarthritis, comes from overuse of some sort, and that's little micro injuries over and over and over and over.
Okay.
So that happens to people. There are different types of arthritis besides osteoarthritis that are more metabolic in nature, and they just things like gout. That's a metabolic issue, and there are crystals that form in the joints, and they just sort of eat away the cartilage. So there's all kinds of arthritis, but generally we can help most people with whatever their issue is anywhere around the body, as long as it's musculoskeletal. A lot of people call me up or email me, and they say, can you treat my blindness? No, I don't do that. I do orthopedics.
Exactly.
No, but there are stem cell studies being done on blindness. The first study I saw was on mice that was done at Harvard 20-some years ago. That's how I learned about stem cells. And they did it IV, and they marked the stem cells with an isotope of some kind so they could actually watch them go through the body. And with these mice with retinal damage, they watched the stem cells go directly to the retinas. So there's a lot of intelligence in stem cells. They know where to go and what to do to help heal the person.
Right.
So thank you very much, Terry. This is good food for thought for people. And we're going to give out the phone number now, so grab your pen and pencils. The phone number to the studio right now, so you can talk to me like Terry just did, is 866-870-5752. That's 866-870-5752. If you would like to call me at my office, that's a different phone number, and I'll give that to you now also. The number to the office to find out even more information is 800-300-9300. It's easy to remember, 800-300-9300. And another way to reach me is through email. So a lot of people go to my website, and there's a spot to email me on every page, and that's www.lastemcells.com. That's www.lastemcells.com, and you can get a hold of me by email there. I get emails all day long, and I always laugh to people, and I say the first thing I do when I wake up in the morning is answer emails. I answer emails between patients, and I answer emails at night, and the last thing I do typically before I go to sleep is answer emails. So there's a lot of people with orthopedic pain out there. It's about 30 to 40% of people. And, the nice thing is, I just thought of the statistic of 30 to 40%. That's the same statistic of healing with placebo. So,
wow.
Wouldn't you rather have a placebo if you could rather than an invasive procedure like surgery?
Beat surgery
and there
every
are studies,
time.
There are studies showing that if you do a fake knee surgery, it works just as good as a real knee surgery. So what's your choice going to be?
It's a good point.
You don't have side effects with placebo and fake surgeries. So if it's me, I don't want a surgery. I had one on my shoulder. It was awful, and the side effects were terrible. And since then, I've been doing regenerative medicine using platelets or stem cells on myself with amazing results. It's not going to work on everybody. I'm not saying it's a miracle. But if we choose the right patient, we're usually going to get great results. Anything for you, Nita, before we go to Janet?
Yeah, sure. I just want to give the phone number again right here at the station. Call Dr. Darrow at 866-870-5752. That's 866-870-5752. And we'll go to Janet in San Jose.
Janet, Dr. Marc Darrow, how are you today?
Hello, Dr. Darrow. I'm fine. How are you?
Good. I understand your wrist bothers you. Which one, your dominant hand or your other
Yes,
hand?
it's my dominant hand. Actually, I have three issues, but I'll talk to you about the wrist today.
Before we get to the wrist, just let me know what the other issues are so I can just keep track of all of them.
I had a L3 to L5 spinal fusion a year ago, and
Okay.
I'm experiencing a delayed union. Part of it has fused, and the other part is taking its time. And the other one is my shoulder. I have a partial rotator tear, and the doctor also thinks it's a bicep tendon as well. And it hasn't bothered me. The shoulder hasn't bothered me for a long time, but now it seems to be coming back and giving me issues.
Sure.
But the wrist right now is a real issue. So I thought if I was limited on time, I would talk to you about the wrist.
Okay. So the wrist is very complex. There's a lot of bones in there, and you can look these up. They're called carpal bones, and they're all held together by ligaments, and then there's ligaments from the radius and the ulna, the big bones that attach to the wrist. So, and then there's tendons in there. It's really complex, and they
Could I
heal.
tell you what they've told me I have?
Yeah, go ahead. Sure.
They've told me I have scapholunate dissociation.
Okay, so that's two of the bones. Okay, so you can look those up on Google, and they've got really nice pictures. So if you look up something like wrist on Google, and then you go to the place at the top that says images, click on images, and they'll show you probably 50 different images of the wrist, and you can see where the scaphoid and the lunate bones are, okay? I treat those all the time, and I had the same thing myself from hitting the ground with a golf club at about 100 miles an hour. So my wrist hyperextended back, and I had the same syndrome you did. I went to a medical conference years and years ago, and they showed people how to do, in the old days, what's called prolotherapy. It's a form of regenerative medicine. And the gentleman that was teaching the wrist section, I allowed him to inject my wrist, and the next day it was 50% better. Overnight, 50% better. I then self-injected myself about 3 or 4 times more, and my wrist has been amazing. I can still play golf. I can do whatever I want, and it's basically pain-free. I haven't really even thought about the pain in my wrist for probably 15 years. So that's wrists heal really quickly.
Really?
For the most part, yeah.
The first experience with it was about 3 years ago, and I got cortisone. They were thinking about fusing my wrist, and I said, no, I can't do that. I'm not going to do that. And the cortisone worked for 3 years, and then it came back this year, and so badly I ended up in the ER. It swelled, it turned black and blue. I couldn't move my fingers at all, and then a few days later it got a little better, and it's happened twice in the last 2.5 months. And it happened 3 days ago again. It all of a sudden it starts to swell, and they said it's is it a ligament that's inoperable or something? It's torn, and it might have happened.
Well, I don't know the answer, but I do know an answer. It's a question of whether it's going to work for you. It doesn't make a lot of sense to me, other than something else is going on. Okay, unless you're doing something explosive with your wrist to have it swell like that and bleed.
No, I'm not.
Bruising is from bleeding.
Yes, and it's slightly bruised. It happened 2 nights ago. All of a sudden, the fingers started hurting, and I couldn't move them, and I couldn't put any pressure between my thumb. If I pressed my thumb against any one of my other fingers, I can't even unbutton my blouse. Wow. It's so awful.
Are you a flamenco guitar player?
No, I don't have to worry about that.
Is there any repetitive activity that you do?
Not that I'm aware of. When I think about it, I am right-handed, and so I do everything with my right hand. But I'm not. I don't work because last year I stopped working because of my back.
Okay.
And so I'm not on a keyboard all the time. So no,
okay.
And I've had carpal tunnel surgery very successfully in both wrists, and haven't had any numb fingers or anything. But now this wrist is really. I mean, it seems that it doesn't have to take anything in particular to bring on this swelling. And then you can see.
I'd have to look at it. You might have a partial tear of the ligament between those bones that may continue to tear every once in a while. That'd be pretty odd. But I'd have to touch it, look at it, and the nice thing about using platelets and or stem cells is we would be able to tighten up all of the connections in the wrist at one time to stabilize it, and hopefully that wouldn't happen again.
Severe arthritis because of this, because the bones are floating freely. They're rubbing each other. There's no ligament.
I hear you. Yeah. I'd have to see it. If you want to call the office, the number to the office is 800-300-9300. And for those of you waiting to call in, the number to talk to me right now is 866-870-572. That's at KRLA. That's 866-870-5752. And Janet, God bless you and your wrist. I think we could help you. I can't promise you anything, but I think probably I'm going to want to do platelets plus stem cells on your wrist. Platelets are great.
Can I ask you a quick question before we hang up, Dr. Darrow?
Yeah, let me just finish my sentence. Platelets are great. Platelets are great. And it's even better if we add stem cells. And you stick with us, Janet, after this short break, and I will talk to you first.
Okay, you're listening to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, taking your calls right here at 866-870-5752. We're going to take a quick break, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.